All right. Well, why don't we start with some introductions, and I think the rest of the folks that join will be able to catch up. First of all, my name is Brian Feely, and I head up marketing for Corporate Synergies and Foundation Risk Partners. And I'm really excited to host the Trump Effect with our Senior Vice President of Compliance. You know him. He is Daniel Cooperstein. Dan, appreciate all the work that you're doing, all of this, and today's webinar on the Trump Effect. I mean, this is different than that first administration. This second administration is first couple of hundred days is going to really make some noise as it relates to taking action, and we're seeing it already. So we're going to go over that. Clearly, we want to know what's happening with the Trump impact on healthcare. So a couple of things to start. This is an accredited webinar. There are SHRM credits and HRCI credits available. We'll get into that at the very end of today's session so you know how that all works. There will be a survey that we'll be sending out to everyone as well, so you can rank how well Dan did. Of course, mine already defaults to pretty good, I think. No, I'm not sure. Uh, but anyway, Dan, why don't you get us started in talking about some of these key executive orders, because it does happen almost on a daily basis. Give us an understanding of a foundation for what we're going to be discussing today.
Sure, Brian. And I think, well, most of the news out there right now, if you turn on your TV or the radio, right, most of the news out there seems to be about Trump's impact on international matters, right? Whether it's tariffs or negotiating an end to the Russia-Ukraine conflict. But really, the Trump administration in its second term really did quite a lot in the world of healthcare policy in just this first month. And so I think we should really, yeah, start there. And so for our agenda today, we'll start out by talking about some of those major executive orders and appointments, and then move from there to talking about how we see these policy changes impacting the health insurance market, right? The cost of employer-sponsored coverage. And then we'll go on to discussing compliance strategies and key takeaways and really what we can do to, to manage this risk and navigate through these waters, um, and go from there. So,
Okay,
um,
take it away.
yeah, so let's talk about the Trump effect, right? So this policy shift we're talking about today, the impact of it is what we're calling the Trump effect. Um, in many ways, it represents a reversal from many of the Biden administration's healthcare policy priorities. And it's a movement that is sometimes referred to by Trump and his cabinet members as the MAHA movement, or Make America Healthy Again. Um, and
And that picture does not look like that's making America healthy again. That looks like McDonald's right there.
Right, exactly. And I
Just
like to put
saying.
this one in there. It's funny. I like to put this one in there because it kind of just shows you what a big shift it is. I think from the last administration, I don't think any of them would have posed a picture together eating McDonald's.
Yeah, that
Um,
was posed. I don't think RFK had any of that, just knowing how he
right,
eats
exactly.
nutrition.
Exactly.
So,
I don't know if he drank that Coke or
yeah.
not, but it's a great picture. And really just shows you that I think one of the things about this picture too is just that I think they're a little bit more open-minded to different things, right? They're open-minded to looking into things that maybe haven't been looked into before. And it's certainly going to be interesting. It's going to be an interesting 4 years. So with that being said, let's go ahead and get started. Talk about some of the big executive orders, right? So right off the bat, right, president comes in, it's January 20th, and just signs this big pile of executive orders. Um, and so many of them had to do with health and health, have an impact on health insurance that obviously couldn't list all of them here. But I think these are some of the big ones that are going to have a big impact kind of right off the bat. And so we'll start with this, then we'll talk about some of the key appointments after this. But before I do that, I do want to give a quick disclaimer, like we always do on these types of calls, which is the first disclaimer, of course, is when it comes to political discussions like this, right? We at Corporate Synergies don't take any sides politically. We're purely agnostic. And today's presentation is meant for really you all out there, right? Employers, plan sponsors of all shapes and sizes, to help you to better navigate this major policy shift in healthcare that we're talking about. And really with the focus being on health and welfare plans in the health insurance market. And while we have a big regulatory compliance team, I think the second disclaimer I want to give is that while we've got this great compliance team here at Corporate Synergies, that's hard at work analyzing every move of the new administration every day. We don't have a crystal ball. I wish we did. But really, given that it's so early in the administration and so much of what we're going to say predictive in nature, right? We could always be wrong. So I just wanted to kind of throw that out there that these are just, our, expectations and of the impact given our knowledge of the lay of the land and kind of how we see it changing already.
Hey, Dan,
Finally, yeah, go ahead.
weren't we predictive almost entirely through the ACA? It seemed like anytime something would come out, we'd be predicting what they meant or when guidance was going to come. So we're in very familiar territory here, being somewhat predictive, I think.
Exactly. It does remind me of the first, yeah, 100%. And I think it's interesting. I mean, this really does remind me a lot of the first term. And maybe that's a third disclaimer, which I should just say is that it is really hard to predict things when it comes to someone like Donald Trump, right? A president like Donald Trump in the first administration really kind of, he was a bit of a wild card or a black box, right? You don't always know what his next move is going to be, where he's going to go. It makes things interesting, right? And there were some very creative ideas that he came up with, like Association Health Plan, or I'm not sure if it was him, but obviously his team, his administration came up with some very interesting ideas like Association Health Plans and ICRAs. So it's going to get interesting, right? And we, as much as we try to be predictive and try to come up with what we think is going to be what's going to happen, it could always change and quite dramatically. So, okay, so let's go and get started and talk about some of these big executive orders. So one of the first ones he did on January 20th was defending women from gender ideology extremism and restoring biological truth to the federal government. And that's a long title, but it essentially says that there's a male female binary determined by biological sex. In other words, essentially saying the government only recognizes the sexes of male and female, and consistent with that, it aims to eliminate federal funding for gender affirming care, prohibit gender self-identification on federal documents, and really make other changes really at the federal government level consistent with that order. And then, similarly, this other executive order issued on January 28th, the second one there, protecting children from chemical and surgical mutilation, is an order that seeks to prevent gender affirming care for minors by withholding federal funding for such treatments. It directs agencies to take steps to prevent surgeries, hormone therapy, and other gender affirming treatments for individuals under 19 years old. There was a recent development here, too, I should mention, that happened February 20th, which is that HHS, the Department of Health and Human Services, issued a memorandum rescinding guidance from the Biden administration on gender affirming care, issued back in March of 2022. And that 2022 guidance stated that transgender medical interventions may improve both physical and mental health outcomes for minors. So this new February 20th memorandum from the new HHS under the Trump administration is basically saying that no, the current HHS policy no longer conforms to that prior 2022 guidance. So we're already seeing some of these executive orders already kind of, have an impact across the government. This third one, expanding access to IVF, in vitro fertilization, more recent one issued on February 18th, is aimed at expanding access and reducing the cost of obtaining IVF. So it really seeks to address, what are the financial barriers and legal uncertainties surrounding fertility treatment, and how do we work together as the federal government to help more families to have children. And so it's very interesting, but it really doesn't really do much. And actually, this is probably a good time to talk a little bit about what our executive orders are, right? I think I know I've already jumped into the first three here, but executive orders, right? They're not really law in the traditional sense, right? They're more of directives, right? It's more of, okay, the president, as the head of the executive branch, is directing his federal agencies to go in a certain policy direction, right? To make rules and regulations consistent with these policy goals. And that's essentially what it is. So it doesn't really have the weight of something like a statute that's been signed into law, that gets passed into Congress. So it's important to remember that kind of as we go through these things. And similarly, like I guess consistent with that, right? The executive order on IVF is really just saying like, we're going to research this further, right? There isn't any kind of specific rule here that kind of comes out of this. So with that being said, also this other one here, the fourth one is a pretty big one, in that it could have an impact on pandemic response. But basically, withdrawing the United States from the World Health Organization, that one came out January 29th. Really seeks to pull us out, the United States, from the WHO, citing the organization's mishandling of the COVID pandemic and failure to adopt necessary reforms. Um, it also pauses future transfers of funds and resources to WHO. One of the concerns here too is just that China had too large of a role in it, and the U.S. didn't like that. So there's a number of issues there, but that really has more to do with kind of pandemic response than but that could, of course, have an impact on insurance. The fifth one here, ending radical and wasteful government DEI programs and preferencing, and the sixth one, ending illegal discrimination and restoring merit-based opportunity, are really about the same thing, which is about uh, getting rid of DEI mandates, right? Getting rid of, uh, you know, terminating all federal mandates, policies, programs, and activities related to diversity, equity, inclusion, and accessibility, DEI. It requires agencies to report DEI related positions and activities to the Office of Management and Budget. So what that first one is really, the first one of those two is really more focused on wasteful government spending on DEI programs. And the second one, or item number six there, is really more about federal contracts with the private sector. So that second one really takes the prior order and applies it to the public sector, from the public sector to private organizations by prohibiting federal contracts with private organizations that enforce DEI frameworks. It also revokes certain affirmative action requirements and directs federal agencies to eliminate what it calls discriminatory DEI practices in the private sector. And if you look at, if you read through these things, right, the focus on these executive orders really seems to be about merit. And the Trump administration really sees these DEI programs as really a kind of discrimination in that they can prevent the most qualified person from getting that particular job or contract. And that is something that they want to prevent, as they see that as sort of an economic issue, right? They believe that it's kind of creating waste in the government, and that it's discriminating against those who may be more qualified or more have, for the particular contract.
And Dan, I think it's important to note that even the terminology that they're using for these executive orders it probably goes into the realm of being a little bit political when they're talking about these things that could be debated on either side by calling them harmful, unnecessary, wasteful, or what have you. That's coming from the administration's point of view on these areas. And so just keep that in mind as you go through it. Again, we're not taking any political side, but
Exactly.
you can read into it as to where the administration stands on many of these. And I may have a question. I'm looking at some of the chat. We probably
Yeah.
won't have enough time to go through chat questions and get through your entire presentation, but I do want to make sure that we capture some of this so that we can respond to people moving forward. But some of them may be in the gray area of, is it yet already understood whether or not some of this is just for federal funding, or is it mandated where, okay, we're not going to get federal funding? For instance, with the second one up there, protecting children from chemical and surgical mutilation, the question came in, is this just for federal funding, or can parents pay this out of pocket? I don't know whether or not you have that clear of a picture on what that's about at this moment, but I do want to encourage people to add questions to chat, and I may check in with you, Dan, from time to time if we have time. But I know you got
Yeah,
a
no, I
lot.
appreciate that. Yeah, so that is about federal funding and the federal agencies. So that kind of goes back to what I was saying just a little bit a moment ago about the fact that executive orders, they can really only kind of direct the federal agencies to do things, right? But they don't have the weight of a law like a statute or even a regulation. They're not even that at that level. So it really doesn't that second executive order really doesn't, at least as of yet, really come down to the individual plan level yet, but it will at some point, right? I mean, we see this now with HHS rescinding guidance that it had issued before on gender affirming care for minors. So at some point, it will have an impact, and it's just a matter of time, really.
Yeah.
So I guess the answer is not yet, but wait, it will impact your plan probably very soon. And of course, we will once there is a sort of major national, decision on a lot of these things that would impact, like a final regulation or a final statute. Obviously, we would send out an e-alert and let you know about those things. So these are, like I said before, just more like directives of where they want to go from a policy perspective. Um, So where were we? Item number seven. Okay, so this one we'll talk about a little bit more later in the presentation, but really the idea here is that there's going to be a regulatory freeze pending review, and this is standard. There's an executive order memorandum issued saying that um, uh, you know it orders a freeze on proposing or issuing new regulations until they are reviewed and approved by a Trump-appointed agency head. It also calls for the withdrawal of rules sent to the Office of the Federal Register, but not yet published, and allows the federal agencies to postpone the effective date of published rules for 60 days. So that's something that we've seen before. The next one here, number eight, is really it's probably one of the biggest ones. It talks about initial rescissions of harmful executive orders and actions. It goes through and revokes executive orders from the previous administration. Now, we'll talk a little bit more about that, but basically, it's a lot, right? It's about 80 different or executive orders and policy directives of the prior administration, dealing from ranging from things like racial equity, combating discrimination on gender identity, climate change, environmental justice, things like that. And then, of course, this last one is really the most recent one. We saw this came out Tuesday, and and of course Trump, actually invokes the MAHA, the Trump effect MAHA thing we were talking about earlier, right? And the name of the executive order is Making America Healthy Again, by empowering patients with clear, accurate, and actual healthcare pricing. And what's really interesting about this is the first of his executive orders that really focuses on his big focus on the campaign trail and in his first term on healthcare transparency. And so that's something we'll be talking a lot more about as we go forward here. Okay. And of course, price disclosure as it relates to health plan transparency and price disclosure as it relates to not just health plans and health insurance like we're talking about today, but also for hospitals and medical providers as well.
So, Dan, I didn't see a big executive order saying the ACA is no longer valid. What say you?
Exactly. And that's, I think, why I put this slide here. If you remember, in Trump's first term, right, a big central policy goal was to repeal and replace the Affordable Care Act, the ACA. But what's notable here is that there isn't any executive order saying we're going to focus on repealing and replacing the ACA. And so, that's, I think, probably the biggest thing here, is just that, we're just not going to see that as a big focus anymore. And I think, that I think reflects the will of the people in many ways. I think he kind of got the point from the first term that it wasn't going to work. Didn't get the approval he wanted. And so the focus is going to be more on what I would call the reform of healthcare reform or reform of the ACA. And we're going to, see what he's doing there in just a little bit. So we'll talk about that in just a little bit here. And actually, we should focus in a little bit here, I think, on just what were some of those things that he rescinded. So I think I mentioned, and I think we mentioned here that there were about 78 or 80 different Biden executive actions that were rescinded, policy spanning from climate, equity, health, immigration, right? But we wanted to kind of focus here on some of the big ones that have an impact on healthcare and health insurance. And so starting with this first one here. So this is a list here of this list of 7 items are the ones that he expressly rescinded from the Biden administration that had to do with health insurance. This first one here, 14,009, strengthening Medicaid and the Affordable Care Act. That was a Biden executive order, really a cornerstone of Biden's healthcare policy that aimed to bolster or improve the Affordable Care Act and Medicaid. It reopened ACA exchanges for special enrollment period, extended special enrollment periods. It directed agencies to review different Trump era policies that weakened the ACA, like work and Medicaid, like work requirements for Medicaid. It sought to expand coverage affordability and access. And so what happened here? So obviously by rescinding that, right, it nullifies that directive to strengthen the ACA and Medicaid. And while the ACA, itself remains the law, and you can't simply just reverse the ACA by an executive order. What it really does is it stops any kind of federal agency efforts to enhance the enrollment and affordability on the exchanges, and it also kind of could potentially stall any kind of coverage expansion under Medicaid. So it really kind of takes us back to kind of the pre-Biden world of the ACA exchanges. And that second executive order that he's rescinding, 14,070, continuing to strengthen Americans' access to affordable quality health coverage, is a really kind of very similar to that first one. It's really pushing for greater access to the ACA exchanges, longer enrollment periods. It fixes the family glitch. It does a number of other things to encourage states to expand Medicaid under the ACA. It aimed to lower premiums and increase enrollment. And really, with obviously rescinding that would halt all of these very specific efforts by the Biden administration to tweak ACA implementation and to make it easier to enroll in the exchanges. And so this could, of course, stall or halt many of those goals, and of course make it harder to get into the exchanges and you know and all those other things we just talked about. So really, those things are really more at the individual level than employer level. So really, this next one I think is probably the most important, probably for employers. He rescinded this 14,087, lowering prescription drug costs for Americans, and this was a Biden administration executive order issued in October of 2022 that directed HHS to test models, different types of models under Medicare and Medicaid to reduce the cost of prescription drug prices. And that aligned with the Inflation Reduction Act's drug pricing reforms. So these are things that were aimed really to sort of ease costs for insured individuals and government programs, and that would sort of indirectly support health insurance affordability. And one of these things was, of course, the well-known thing about directing Medicare to engage in direct drug price negotiations with Medicare, which actually was codified into the Inflation Reduction Act. So that's actually, even though he's getting rid of this executive order, he can actually get rid of those pieces that were actually codified and became part of the statute in the Inflation Reduction Act. Up in the news quite a bit recently because, right, by rescinding this, he stops these sort of executive-driven things that can reduce drug costs. And an example of this would be in the Biden administration, they propose these different models for lowering costs, like a directive encouraging Medicare plans to cap certain generic drugs at $2. Those things, of course, he got rid of by this, but not the one that eventually became part of the Inflation Reduction Act. So I heard in the news, when this happened, I heard in the news that this was going to be a really bad thing for drug prices, of course, and there's a lot of negativity about it, but it doesn't mean that the Trump administration is going to be pulling out of those things that are part of the Inflation Reduction Act, like the direct Medicare price drug negotiations. It also became news because right before Trump became president, the news came out that the GLP-1 weight loss medications would be added to the list of drugs that would have direct Medicare negotiation, and so there's a lot of fear and concern that those cost reductions would not happen. But in fact, because it's part of like I said before, part of that statute, Inflation Reduction Act, they will still be part of those direct Medicare negotiations, although it's unclear how vigorously the Trump administration will pursue price reductions as part of that process.
Hey, Dan,
Yeah,
just it's interesting. We see all of these executive orders, of course, and as you said, this does not mean that it's law yet. And
yep,
we just had a slide before that said the ACA is not going away. But I think, everybody on this call would probably agree that they stand behind access to care, right? Access to affordable care, making sure that everybody gets the type of health care that they truly deserve. But I would bet the majority of the people would also say, we don't want to be the folks that have to go through the minutia to prove all of that with all this reporting that we have to do. And so what I don't see is anything related yet to any of the requirements on the part of employers to work through all of the legal requirements of reporting and what have you. In your crystal ball, do you see anything related to that to give a little bit of relief to employers, or are we going to see it mostly shift into other areas of healthcare, leaving that alone for now?
that's really a great question. It's something I plan on talking about later in the presentation because I think it's certainly one of the big questions here, right? And because Trump campaigned on the fact that he wanted to reduce regulation, cut the government, right, reduce bureaucracy, and make things easier for employers. And but at the same time, right, he also campaigned on the fact that he wants greater healthcare transparency
Right.
and more access to the actual prices that things cost, so people can shop around better in the healthcare system.
Well, I don't want to
So
get ahead of myself then. If you're going to cover it in a
yeah.
little
So
bit,
we'll
let's
talk about that.
go
Yes.
there.
Yeah, we'll
Yeah.
talk about it. We'll
Right.
get there. And actually we can skip the rest of these because I think the rest of these ones here really have a lot to do with COVID, the COVID pandemic, and a lot of the things that he did with these other ones is just get rid of workplace requirements during the COVID pandemic, which have already in many cases are no longer requirements. And so it's not as relevant as these other ones, these top three. So we can kind of skip through that slide and kind of go on to the next one. Um, Okay, so let's talk a little bit about appointments.
Did you, I mean, as it
Yeah.
RFK, so a lot of people, this was a very controversial pick, and a lot of people didn't think that he would be confirmed. But he is, what does RFK's impact mean for us now that he's the head of HHS?
Yeah, that's a great question. I mean, he's definitely going to have a very, very big role, if not the one of the biggest roles, right? And that makes sense given that it's the largest government agency overseeing and regulating healthcare in our country. Right? There's so many other sub agencies that fit into HHS, including, for example, the Office for Civil Rights, the CMS, Centers for Medicare and Medicaid Services. So when we look at kind of the major healthcare things in our country, right? He's really going to be the head of those things. And there's still a lot of questions. How is he, what is the policy direction of RFK? Because and how is he going to be, there's a number of lawsuits out there, right, where HHS is defending current positions of the government that, well, actually, we should say they were positions of the Biden administration in litigation. And that litigation kind of is still pending. And we're going to talk about some of those cases, right? So it's going to be really interesting to see if RFK, right, someone who really values individual rights and healthcare autonomy over big government and government overreach, how someone like that really defends some of these HHS positions taken during the Biden administration. When it comes to things like reproductive health care, and including reproductive health care privacy and the new HIPAA rule on that, right, the rights to contraception, and things like that. Where is he going to go? And I think it's still a big question mark. And we are going to talk about that. But first, I think we should talk a little bit about some of these other appointments. I think since RFK is such a big question mark, I think we should talk a little bit about some of the other folks who are probably going to have a very big impact on health insurance. And then we can kind of look at, we're going to, I think in a little bit here, just look at some of those cases that are pending or outstanding and see how they could possibly change. So let's look at some of these other cabinet appointments that have an impact on health insurance. I think most people out there probably know who Dr. Oz is. So I did prepare a long background on him. Of course, he's the TV doctor personality. He has not yet been confirmed yet to be the head of CMS, the Centers for Medicare and Medicaid Services. That is going to be coming up soon. One of the big ones is Scott Bessent, who is Secretary of the Treasury. He has been confirmed. He is a former hedge fund manager. He was a chief investment officer and partner at Soros Fund Management, and he also founded Key Square Group, a global macro investment firm. So he's also been an economic advisor for Donald Trump and was that in that role during the 2024 presidential campaign. So what's really interesting about him is he's someone who's really in the private sector, right? I think if you look at some of the past Treasury secretaries, people who had the IRS, a lot of them have been kind of bureaucrats in many ways. And here you have someone who really understands, a hedge fund manager, right? Someone who really understands markets, who understands the stock market, right? When Trump became president, he actually went to the floor of the stock exchange, something that Ronald Reagan did, right? That's something very different from Biden. I don't believe Biden ever went to the stock exchange in his 4 years. So it really kind of signifies this kind of shift of, we are interested in improving the stock market. We're interested in the private market. And then I think we should probably also talk when it comes to employee benefits, just in the interest of time, kind of focus on two more folks here. Daniel Aronowitz, who is the new director of the Employee Benefit Security Administration of the Department of Labor. That's the division of the Department of Labor that really oversees health and welfare plans, which is really what we focus on here. And Daniel Aronowitz is a ERISA attorney and a fiduciary expert, really a thought leader in the area of ERISA and fiduciary liability. He's the president of he was the president of Encore Fiduciary, which was a firm that worked with plan administrators on ERISA compliance, and really just someone who has a lot of experience in this area. And then, of course, the other one we should also talk about is Anthony Archibald, who will be acting director of Department of Health and of the Office for Civil Rights within the Department of Health and Human Services. He's also an attorney who previously served as the Diversity and Inclusion Director for the Health Resources and Services Administration during Trump's first term. And he has been involved in many initiatives to combat discrimination and ensure compliance with civil rights regulations. One of the big rules, of course, that OCR enforces is the HIPAA rules, the HIPAA privacy and security rules that we talk about a lot. So he's going to have a very big role in that. Okay. So let's talk a little bit about this. We talked briefly about the executive order about the regulatory freeze, but there's also something called the Congressional Review Act. And so, we talked about the regulatory freeze, right? Which is basically that they can put a 60-day regulatory freeze on rules that have been issued but haven't yet really fully taken effect. And the other big thing here is the Congressional Review Act. So this is a law. Basically, Congress can negate certain administration actions taken close to the start of a new Congress. Generally speaking, things that happened on or after August 2024, they can also essentially review and decide to freeze. So, these two rules, right, the regulatory freeze and the Congressional Review Act, really put a number of different rules in the crosshairs, or I guess you might say that they have targets on their back, right? And I think one of the biggest ones that we haven't talked about thus far is the Mental Health Parity and Addiction Equity Act, or MAPIA, which a final rule was issued on September 23rd of last year, that went into effect at the end of last year. And that's one of those ones that, Brian, you were, I think, referring to probably when you said one of those things that gives a lot of headaches for our clients, right? A lot of our clients have to deal with this NQTL comparative analysis, and it's a little bit of a nightmare.
We had some live briefings on that for
Yes.
sure.
Exactly. So you remember that one. So that's one I think that is going to probably, and there is a case challenging it from, we'll talk about that in just a little bit. So I think that's certainly in the crosshairs. And then, of course, this other one, non-discrimination, ACA, final rule issued under ACA Section 1557. And I think that is going to be a big one that's going to be, in the crosshairs. HIPAA, I think the third one here, of course, the HIPAA privacy rule on reproductive health care, went into effect in June of last year and requires certain protections in the event of an investigation of a health plan. So in other words, if let's say the state of Texas or another state that has like an abortion ban in their state comes to your health plan and says, I want to see all of your abortion records from your health plan. As part of this rule, you would have to give them an attestation to fill out and say you could only get access to things that were not, abortions and other reproductive health care that was not lawfully performed. So it's this one was a rule that kind of came out really at the end of last year and created a lot of headaches as well. But that is probably also being challenged in the courts, and we'll talk about that in a little bit. And then, of course, this last one here we did talk a lot about, which is about short-term limited duration insurance and some of these other types of plan arrangements, including fixed indemnity plans and wellness type fixed indemnity plans. And that is one that's probably more, it went into effect in June of last year. And I think that's another one that I think is going to be also in the crosshairs. And of course, there were recently proposed rules, one of which has been withdrawn on preventive services under the Affordable Care Act, that really sought to enhance and expand contraception and the availability of contraception. And then there was also a rule that was proposed seeking to modify the HIPAA security rules to better protect them from cybersecurity events and protect plans. So that one I think could also come into the crosshairs. So we'll be looking at those closely. And I'm going to go through these very quickly, just in the interest of time. But these are some of the big cases that we're following closely out there that really talk a lot about um, the issues of health insurance. And one of the first ones, of course, is this ACA Section 1557. So just sort of a brief refresher to refresh your recollection about ACA 1557. It was a section of the ACA that it's kind of been like in a football game, kind of going back and forth between the Republicans and Democrats. But basically, there was a part of it that prohibited. The law basically says that if you get federal funding for your health plan, that you have to prohibit sex discrimination on the basis of gender identity. That was a rule that came out during the Obama administration. In Trump's first term, he got rid of the gender identity part, and then during the Biden, it came back. And of course, it's being challenged in cases now by several states. Texas, Tennessee, Montana. Tennessee and Montana challenged it. Now it was the 2024 final rule under ACA 1557 that came out during the Biden administration has already been been enjoined nationwide on most of its key provisions. In the case of Tennessee v. Becerra, so basically a district court issued that it's pretty much no longer in effect. And in two states, Texas and Montana, all provisions of the rule have been stopped. So it's essentially pretty much dead at this point, but there are other lawsuits still pending out there that are. So that's probably going to be no longer, that's probably going to go away. And then the other one is the HIPAA privacy. I mean, it's pretty much gone already, I should say. But the other one is next one here, the HIPAA privacy and reproductive healthcare rule, is that rule I was just telling you about, where you have to give an attestation that any actor seeking to get information about reproductive health care from your health plan has to fill out this attestation. And there's other requirements as part of this reproductive health care privacy rule. And there's a number of challenges out there. One of the big ones is this case, State of Texas versus HHS, that was filed in the Northern District of Texas. I should say it was decided on September 4th of 2024 and issued a preliminary injunction in favor of Texas, basically putting this thing on hold until they could. Basically, the court issued what's called an order holding briefing and abeyance. That's a lot of fancy legalese for the fact that they basically put the case on hold so that the new HHS could go back and amend their briefs, right? Update the briefs to reflect the current policy position of the HHS, which most likely it's still a question mark because we don't know how RFK Jr. and the new HHS is going to take a position on this. But most likely, I think they will probably not seek to defend this reproductive health care privacy rule. And we have another case where Tennessee and 14 other states filed a lawsuit against HHS in the Eastern District of Tennessee, seeking to also get rid of this rule. That is still out there. We're still waiting to see on how that's going to play out. But I think probably this is where RFK is probably going to pull out. But we'll see what happens. And then we've got the last one I was telling you about, short-term limited duration insurance, fixed indemnity, wellness plans, these other types of plans. And the main point of these rules that came out in the Obama administration was saying, look, these things are not real major medical plans. And so you have to give notices and things to your participants that say, these things are kind of flimsy, right? And you can't rely on this to be your major medical coverage. So anyway, right before the end of the year, there was a case, Manhattan Life Insurance and Annuity, the HHS came out and said, okay, we're going to we're going to vacate this notice requirement that for fixed indemnity plans that basically, what I was just saying, right? You have to give this notice out to all plan participants, saying this fixed indemnity plan is not a major medical plan. But this got rid of that requirement. And then while there was a Department of Justice notice of appeal that was filed, it's unclear. That's still a pending case. There hasn't been a final decision after that, but it doesn't look like that's going to come back. I mean, I don't think there's any way we're going to have to get that notice back. There was also a challenge on the STLDI restrictions that's ongoing. So we're still continuing to watch kind of how we're going to look at short-term limited duration insurance. That was another one that's kind of a little bit of a political football. So if you recall, so when the ACA came out, the Obama administration tried to make it clear that STLDI is not real major medical insurance. Then Trump in the first term said, well, actually, let's try to remove some of these restrictions on STLDI to make it, because people don't have anything out there, let's give them something, right? And then of course during the Biden administration, that they came back and said, look, we got to tell people this isn't real major medical coverage, and so it's kind of one of those things that kind of flips back and forth, and that's probably going to go back to the way it was in the first term. All right, now gender affirming care litigation is another hot big area, right? We saw that is part of this executive order that we talked about earlier, right? About gender affirming care for minors. They really want to reinterpret how this works, under the new HHS. And there were two big cases out there that are still being challenged in federal district court. One is PFLAG versus Trump in the District of Maryland, and one is State of Washington v. Trump. And then there's this big case, US v. Shkremeti. I don't know if I'm pronouncing it right, but basically where the Biden administration intervened in a challenge to a Tennessee law, SB1, that banned gender identity care for minors. So here the state, right, passes this law saying, we're going to ban gender affirming care for minors. HHS comes in and says, no, we're going to challenge that. And they, essentially the former administration took the position that it denies equal protection under the laws, under the 14th Amendment of the Constitution, on the basis of sex. And then of course, more recently, in a letter to the Supreme Court on February 7th, the U.S. Deputy Solicitor General said that the DOJ under the Trump administration is going to reconsider its position on SB1, and now does not believe that the law violates the equal protection clause of the Constitution. So now, even though the U.S. is dropping the challenge to the law, they did say that they would urge the court to issue a decision based on the private parties' challenges to the law. Basically, this is, I think, very symbolic of kind of what's been happening, right? It's kind of the theme of everything we've seen so far, right? And then, of course, we have mental health parity final rule. This goes back to, again, the NQTL comparative analysis that we know so many out there are really struggling with. The ERISA Industry Committee, which is essentially like a lobbying group of plan sponsors and employers, filed a lawsuit against the agencies that implemented this. Now, I will say that the MAPIA rules were part of that were made to be a little bit harder to comply with, were signed into law by President Trump as part of the Consolidated Appropriations Act of 2021, or the CAA. And so in many ways, Trump kind of set this into motion, but I don't think that the current, Trump and his administration would have ever imagined that it would have got as complicated as it did. And so, in any event, the lawsuit challenges, the statutory authority to issue this rule, the different parts of the rule, including the fiduciary certification requirement of the rule and other things. And I think this is where, going back to your question earlier, Brian, right? This is where I think the rubber is going to really hit the road because, right? So here you have something that kind of came out of a Trump rule, right? Something he's been talking about for a long time, which is I want more transparency. And out of that came this much more detailed disclosure that has to be readily available, this NQTL comparative analysis. But then it became so burdensome from the regulatory agencies under Biden that now people are suing to get rid of it. And it's going to be interesting to see how that plays out.
Yeah, and this, it's interesting news. You're looking right now about, all of these executive orders, obviously, that you talked about, all the changes in the administration. We're only a little month in. What do you see, from an employer standpoint? What are some of the big risks to, when we're talking about cost, prescription drug costs and things of that nature? You've touched upon it right now, but from an employer standpoint, where do you see some of these actions? Is there any concern that some of these policies might require plan design changes? I mean, I know it's early, and like you said, you don't have a crystal ball, but some of these things that are happening, they're going to have impact. And while most people, are in those early stages of thinking about what they're going to do for the following plan year, what do you foresee as it relates to plan design impact?
Yeah, yeah. So I think there are two parts to your question, right? What are the big impacts on cost of health insurance, and what are the plan design changes, right, that
Right.
employers will have to do in this new market that we're in that results from some of these policy changes? So, I think, well, the question is, will there be changes? Yes and yes, right? I think it's pretty clear that there will be changes. And that first question about cost, right? There's definitely an incredible amount of uncertainty, right, that's out there, and in some ways, the word uncertainty is a little bit of an understatement, right? Because it's like it's really unclear, right, how all of these different things are going to impact the costs for insurance. I know we talked a little bit earlier about some of the changes that could impact the cost of GLP-1s in Medicare. And we don't even know yet how that might impact the non-Medicare health insurance market, right? And so there's just a lot of uncertainty, and that's really kind of the key word in all of this. But I do want to talk about these kind of five things, which I think are kind of the biggest kind of things that could happen in the market. But before we do that, on your second question on the plan design thing, I think yes, I think it's definitely going to be the case that there will be plan design changes that will need to occur. And it's just we don't know yet what those things really are going to be. But I would say probably one of the big areas that we'll see plan design changes needed will be in the area of reproductive health care because right, the new HHS is going to probably most likely, right, give more deference to state laws and regulations that put considerable restrictions on abortions, contraception, gender affirming care for minors, right? So, while it's probably still too early for us to go out and recommend any kind of specific kind of plan design change at this point in time, I think that's the area where we really want to be watching it very closely and, stay tuned very closely for that because that's really going to be, um,
I mean, that was
very,
part of the platform. That was part of the platform they were running on. There's
yep.
been a lot of focus, a lot of talk about it. So you would expect that there's going to be action taken on the part of the administration. So yeah, it makes sense to keep an eye out for that.
Yep. So let's talk a little bit about some of these things here. And we've talked about reproductive health care. I think, that's pretty obvious, but what about tariffs, right? So I think tariffs is
Yeah.
one of those interesting things because drug importation, right? That's such a big thing. And right, tariffs, I think, have an impact on not just drug importation, but the cost to manufacture drugs from other countries. And I think most of or a very large amount, I would say, I don't have the exact number, but a large amount of generic drugs are manufactured in China. China just got a 10% tariff levied on them. And then, of course, a large amount of drugs that are imported into the US are imported from Canada, which we know will soon be getting a 25% uh, uh, tariff levied against them. So I don't think there's any way to say that there won't be sort of a negative cost impact there. In fact, I did look at some of the larger, economists and healthcare policy firms out there, what their predictions would be. And I would say that the consensus was that there would be at least a 5 to 10% increase in the cost of generic prescription drugs, and as high as a 15 to 20% increase in cost potentially, just given that so many of generics are produced in China. And just they do think that will, and of course, the fact that there are also drugs manufactured in Mexico. And so Mexico is also going to get a 25% tariff. So there's a lot of concern out there, but I think everyone, for the most part, all the reputable big policy firms out there are expecting at least a 5 to 10% increase in prescription drugs, in generic prescription drugs as a result of the tariffs. But of
Well, you know
course,
what's interesting though,
yeah,
Dan?
yeah,
You have to say, and I think tariffs, a lot of folks didn't understand tariffs to begin with. And then throughout the year, it became a little bit more clear as to who pays the tariffs. I mean, China's going to pay for the tariffs. No, China doesn't pay for the tariffs. The tariffs are happening and we're paying more as a result. But here's something that's interesting. Yesterday, Eli Lilly just made the announcement that they're going to be building four manufacturing facilities, $27 billion investment into the U.S. To manufacture their pharmaceuticals here in the US. So now, was that already in the works and planned as all part of this? But if you look to those that say, here's how tariffs could work, that's an example where they say, well, we want more manufacturing in the US. I mean, I forget how
mhm,
many jobs it's going to provide for. But in theory, if you are someone who believes in that actually making a longer term positive impact, that's an example of it. So
right.
let's
There
see
might be
where
some
this all
short-term pain.
goes.
That's exactly how President Trump has been speaking about this, is that he sees it as a sort of like a short-term pain for long-term gain, right?
Right.
That will bring in more of the drug manufacturing into this country, will reduce the costs through transparency and other things, and ultimately it'll be better. We'll be better off than we were before, right? That's kind of the goal, and I think that makes a lot of sense. One of the other big things here, before we talk about the cutting the bureaucracy, right, which is I think a hot topic, and what the picture is here, you see the head of the Department of Government Efficiency, billionaire Elon Musk, brandishing a giant saw, right, to kind of celebrate that. I think we should also just talk briefly here about kind of the cuts to Medicaid. There was a big Republican-led House uh, initiative to cut Medicaid spending and budget, supported by the president. And the way that they're talking about this is that it's designed to be gained primarily from cutting out fraud and waste. But of course, folks are very, very concerned, right? You've got over 70 million Americans dependent on Medicaid. So there's a big concern about Medicaid. What's the future of it? What's going to happen? And there was a really great fact sheet. Actually, Brian, you showed this to me. There was the American Hospital Association issued a fact sheet about Medicaid, published on February 7th, just explaining really the critical role that Medicaid plays for hospitals and healthcare providers. And some of these stats here, right? Over 94% of hospitals have 50% or more of their inpatient days paid by Medicare or Medicaid, and more than 75% have 67% or more of such days covered by these programs, right? These are highly dependent. And so highly dependent on Medicaid, right? So obviously they're very concerned about these budget cuts because they're concerned that it could mean that the prices go up, right? Because if they don't get all this funding from Medicaid, the prices could go up at hospitals. But I think a lot of that is still yet to be seen how that's going to play out. Still very early in that. But of course, the one I think that's probably gotten the most media attention, right, is this Department of Government Efficiency cutting, right, jobs, layoffs at the federal agencies. What is that going to do, right, for health insurance? And I think it's also along the same lines as your question about cutting regulation and red tape. I think they kind of see these things kind of together from their policy viewpoint. Well, I can say that there have been layoffs at the IRS, right? There's been over 6,000 estimated layoffs at the IRS. Now, the IRS's Treasury, they're saying these are non-essential positions. They're not going to eliminate any of what they call essential positions during the tax season. But of course, this is something we talked about in the last webinar, right? A lot of those folks are very important to audits and investigations of health plans of health insurance, because it's just you have less and less people people doing more with less, right? People have to do more and more with less, and they're overwhelmed. So I think it will have some impact on audits and investigations of health plans.
Absolutely. I mean, there's going to be this will play out over a long period of time, and it costs are. This is not a flip of the switch where there's savings felt by everybody, and it's definitely going to be something where many groups are not going to see those savings. And so I don't know where they're going to be able to find a level playing field for those that are struggling, but you would hope that somehow they're able to take, the idea of bringing efficiency to government and finding fraud and all of that. That's great. But let's make sure that those that are being impacted the most find a way to be able to find affordable care in all of these areas related to healthcare, pharmacy, pharmaceuticals, access to care, you name it. I'd hate to see things gutted that exclude them from any of the types of savings that they're talking about. But we'll see where it goes.
Definitely. So I know we said we're going to come back to transparency, right? I think that's going to be, I think, one of the most interesting things because just 2 days ago, right, Tuesday, President Trump releases this executive order making America healthy again by empowering patients with clear, accurate, actionable healthcare pricing. And what he says is, I really want to see the hospitals and the health insurance companies publicly post the actual prices for their common services, right? I want to know the cost of an MRI scan, a C-section. What does that actually cost? Not just estimated costs. And he said, I want to build on what I did in my first term. I want to really make sure that we can really try to allow consumers to shop around, right? And improve these online tools, right? We talked about this, right? So if you look at the timeline here and obviously you look at the very beginning, the far left of this timeline, right? President Trump in his first term was really at the forefront of this kind of big movement to create greater transparency in health plan coverage by first issuing a public executive order on it, and then signing into law the CAA, and saying, look, this is a policy priority for me. So it was really interesting that just 2 days before this presentation, Trump kind of came out and said, look, this is still a policy priority for us. And I think it's a great place to kind of end, because I think it's going to be really interesting to see like what, I don't think he probably intended for all these regulations and prescription drug reporting, all these things to kind of come out of it. So it'll be interesting to see if he's going to be reducing some of that regulation. But I definitely think that it will remain a policy priority for Trump in this
Yeah,
second.
you like to see that continue. That goes way back. I mean, but transparency is always good in all areas. You bring to light, where there may be some unhealthy profits, if you will, being taken, and we don't want to see that. We want to make sure access is for all and it's affordable. So,
Definitely.
what are some of the key takeaways here, Dan?
Yeah, and I left here, so I'm just going to try to go through kind of the big picture things here, right? I think looking at healthcare policy generally, right? What do we kind of talk about, right? I think this administration is going to really prioritize market-driven approaches and options over kind of sweeping federal mandates, right? It's going to try to do more to create exceptions and exemptions from federal mandates, like for religious individuals and organizations. It's going to try to reduce funding for ACA exchanges and including navigators and outreach access, right? It's going to also be halting or stalling Medicaid expansion under the ACA, and doing things, even if it doesn't necessarily mean cuts to the Medicaid program's, actual benefits. It might just mean there's going to be, it's going to be harder or for states to get access to that funding. There also will likely be some reduced costs of prescription drugs. I mean, obviously, he said that 2 days ago, but I think not just through transparency, but also other measures that may be more even thinking about that are employer friendly, things like he did in the first term, like association health plans and ICRAs, things like that. But of course, tariffs could still negatively impact those, at least in the short term, right? So as that's something we talked about, right? I think you have to be aware of that. Reproductive health, right? I think this is probably where we'll see big changes. He has already said many times he wants to leave abortion policy to the states. He doesn't want that to be a federal thing. He wants to leave it to the people, to the individual states. He wants to oppose gender affirming care for minors, propose broad exemptions and exceptions for the ACA contraceptive coverage mandate, really try to expand access and lower the cost of IVF. And then I think one of the big question marks on reproductive health is really RFK Jr., right? I think how is his HHS going to be prosecuting or defending some of these Biden era positions and pending litigation? And I think that's still kind of a big question mark. And finally, of course, transparency, which we just talked about, right? I think there's no doubt that's going to remain a policy priority for the Trump administration. And he's going to continue to support transparency in both of his CAA and the 2019 regulation that he came up with. So that's kind of the big stuff right there. Big takeaways.
Well, it's a lot. It's a lot. You know what? The one thing about this, and I know we're up on the hour here, and that is that we will have a lot to talk about over the next several years. Those as those executive orders, laws, whatever it is that brings us further information about what impact administration has on healthcare, on employee benefits, we will be bringing it to you. And if you go to the next slide, I think that we want to make sure that we call out resource areas for you. I mentioned we do live briefings and other webinars. You can find them on our website, the Compliance Resource Center, a great area for you to take a look at, what is news versus what is law. Join us for our Health and Welfare Compliance Forum. You can find that information online, again, in our events page. Get invited. Sign up for our events so that you're in the know as to when we're bringing these to you. The recording is going to be to everybody, so we'll make sure that we always are providing you this kind of information. We hope you found it helpful. By all means, engage with us. If you're a client of Corporate Synergies, engage with your account management team to let us know what you think. We really appreciate it bringing it to you. Thank everybody for joining. Dan, thanks so much for all your information. We really appreciate it. Have a great day, everybody.
Thank you. Have a great day. Thanks.